Commissioner Baker McCormick,
I'm sure she'll be here shortly.
Commissioner Marecki, Commissioner Anderson,
Present.
Commissioner Khalil,
Here.
Chair Scott,
Present.
you have a quorum present.
Thank you so much. Yeah. Thank everybody for getting here so quickly. Went over time. All right, next item, please.
B, Chairwoman's remarks.
I have none.
C, approve the June 11th, 2024 meeting minutes.
Move approval, Madam Chair.
Move. All in favor?
Aye.
Okay. And I vote yes. Next item.
Business requesting commission approval of Amendment 2 to a fiscal year 2024 Local Health Department Comprehensive Grant Agreement with the Michigan Department of Health and Human Services to continue to receive and disperse state grant funds to carry out program activities for numerous local health department program services.
Thank you, Madam Clerk. And we do have someone to speak on this.
All right, and Madam Chair, I'm here for the record.
I said you'd be here shortly. Thank you.
Good afternoon, Commission.
Good afternoon.
Good afternoon. Brianna Osorio, Public Health Division Director. This is just regarding, this is our second amendment to the MDHHS CPBC grant that we receive. And so this is allocated to various programs across the Public Health Division and Clinical Care Division that we were expecting to get to as well.
Okay. When you say across,
Yes, so it is, there are certain grants that receive, only a few of the grants receive additional amendments that we were expecting to get to. So we just reallocate those out, so.
thank you. Anyone have any questions? Commissioner Marecki.
Thank you. So there's some new categories that are going to be receiving funds.
There is just one, which has just been the SDOH, which we just received as well. But there's not many other additional.
Okay, SDOH.
Oh, that's social determinants of health.
Okay, this is like the long-term project.
Yeah, it's a new project that they
Are
just
we doing
started.
this with Wayne State? this the one?
No.
Can you tell us more about this?
That is one that I do not have way too many answers on, but it's pretty much about allocating resources and making sure that the community knows. And so this is really getting out into the community and basically letting them know about the resource that we offer at Public Health Division.
All right.
Yeah, okay.
Aja Harris Martin, HHVS. Aja Harris Martin, HHVS, Chief Programs Officer. So how we're going to allocate the social determinants of health allocation from MDHHS is to, one, build a resource guide to collect all of the resources that we have within Wayne County that can service all of our residents' social determinants of health needs. So that's financial wellness, physical wellness, local FQHCs, et cetera. So it will hire a staff that can do that and build out a website. And then the other portion of that is something that we hope that you'll see by the end of this fiscal year is to fund a mobile grocery store that will provide farm stand fresh produce to all of our Wayne County residents. So that's currently under RFP. So this grant will also support that project as well.
Wow, how many of those will you have?
We're hoping to have two, but we're going to start with one.
Okay, all right.
Yeah.
But this isn't affiliated with, I remember Dr. El Sayed talking about looking at statistics down the line.
Mobile for which statistics?
Statistics about health, like health issues in Wayne County. And I thought it was working with Wayne State at one point to get these numbers up. Maybe this is a completely different program.
It's probably somewhat I'd say it's probably somewhat related, but I mean, these are just a part of the efforts that we're going to make sure that we're kind of like looking at population data and things like that. for
And so
ourselves.
with the trucks of produce,
Mhm.
what are you hoping to do with that? Are you going to provide weekly recipes? What are you
So
going to
we're-
do with this?
Yeah, we're currently building that out. So it's under RFP. We're hoping to release it to the public, hopefully within the next 2 to 3 weeks. So you all can share it with other businesses within your respective districts. What we're hoping is that they can provide that local produce. A lot of, I think over 57% of our county is quote unquote a food desert by the USDA.
Yeah.
So we're hoping that this food truck provides access to fresh fruits and vegetables to our residents that are in need of that, so that they're.
And they will buy this?
Yes, they
Okay.
will buy it, yes. And so this is to fund the operation behind building it. So that's what the SDOH grant will help with.
Okay. Thank you.
Mhm. Thank you. Anyone else? Yes, Commissioner Colleen?
Yeah, thank you, Madam Chair. FYI, I'm on the board over at Authority Health,
Mhm.
and we are just ready to put a fresh fruit, fresh food truck out. But it's only like in 5 zip codes on the east side.
Okay,
So you might want to talk to them and maybe coordinate.
okay,
But this notion, social determinants of health, has really taken hold in the profession in the last 15,
yeah,
maybe 20 years. And what they're looking at with health, because, and I forget who does this, but Wayne County always ranks last of all the counties in Michigan for health for its citizens. And there's various reasons for it. So in the health field, they're saying, you know, it's not just whether you have diabetes or not. Do you have access to transportation? Can you get around? Can you get shopping? Are you employed? That has a big impact
Yes.
on health.
yes.
And so there's all these other different things that are looked at that play into a person's health. And this is part of that effort.
Yes, yes, it is.
So, and maybe too, with the new medical examiner going to Wayne State, because that's one thing that they're looking at too, is morbidity and mortality and what is it that people are dying of, and gathering that sort of data as well. So this is great. So the state is in on this,
Mhm.
and so I'm in full support of going in this direction. Thank you, Madam Chair.
Okay, do you have the zip codes that you're going to?
No, not yet. I think that's just a build, and that's something we're gonna look at and assess pretty much of like where there are the different food deserts and things like that, to make sure that we're directly providing access.
Okay, can you share the zip codes where?
will.
Okay, yeah, that would be great.
Okay,
Thank you.
I'll see you right after the meeting. I got a list on my desk, right?
okay.
Because you get these grants for these zip codes and I'm like, well, wait a minute, this is 2 blocks out of the zip code. Oh, we can't, you know?
Yeah, okay.
So, yeah,
Yeah, and
Definitely
personally, I
do
would
that.
like to
sure.
see those.
Because
zip
it's your
codes.
zip codes.
Yes,
as well.
I know. That's
Yep.
why I want to
All right, we'll
know.
get, yep.
Okay, Commissioner McCormick.
Thank you, Madam Chair. The social determinants of health, you touched on, I don't know if you have the answers to this, but preventative measures,
Mhm.
are you focused on things to prevent and what are those, what does that look like?
So a lot of what our resources are supposed to be are much more for prevention. So you want to make sure that you're trying to figure out how to tackle things before we're at a crisis for someone. So we want to make sure that we improve people's access to the things that basically will put them at that gap or that disparity gap, essentially. So what you want to do is try to improve by providing them access to foods, transportation, a lot of our services. So this is really a part of, we want to make sure that we're getting back out into the community and make sure that we're kind of like rebuilding that trust and providing that education and health promotion. We're planning to do more events and things like that in order for us to make sure that we're let everybody know this is what we have here, and these are the resources that we also provide. And these are all things that are to help with that prevention in all different areas.
Okay, but do you have a actual plan, I guess, with the list of preventative measures or activities that you're going to implement at this point?
Right now, it's just more of in the planning phase of how we're going to be able to do that and be effective in that.
Okay.
Good afternoon.
Good afternoon, Doc.
Abdul El Sayed, Director, Health Officer, Wayne County Department of Health, Human and Veteran Services. Brianna did, Director Osorio, did a great job talking through. I want to think about what's that space. So, you know, you get somebody sick, right? If they're sick and they come in, you can treat them. Before they get sick, you want to prevent their illness.
Exactly.
But there's also a level of intervention that's before you ever prevent a specific illness, right? So if I wanted to tell you, you ought to, you know, to prevent a heart attack, I could give you, right, a certain number of medications, a statin being one of them. That would be a preventive treatment, right? But the bigger picture is also thinking about what kind of job you work, what kind of commute to your job you have, what kind of house you live in, the circumstances of your neighborhood, whether or not you can come home and actually walk in your neighborhood without fear of being victimized by a neighbor or like the state itself, right? So the social determinants is about thinking about before prevention. And so it's not really as much about asking about specific prevention measures, like did this person take a statin or did you measure their cholesterol or blood pressure? It's actually more about asking what are the social circumstances of their lives that create the pathways to all kinds of illnesses. Don't you think about it, right? Every time you take a breath in a polluted part of town, when you take that breath, because of the pollution inside of that air, could both cause asthma or cause lung disease later on down. So if we're able to keep the air clean, we're preventing both of those outcomes. Now, we're not doing it specifically to say we're preventing one or the other. We're saying that clean air is a function of health in a lot of different ways, whether it's those lung diseases or a heart attack, et cetera. So a lot of what we're trying to think about here is upstream of actual prevention. How do you make sure you're addressing everything from access to walkable environments and healthy food, good housing, reasonable work environments? That's what we're trying to build around. Now, the hub is a first start, right? It's not going to be able to take on all of these challenges. But it is a first start toward being able to build out a series of programs to help us to do those things. And the food truck program that you heard about is exactly that. We know that in a lot of parts of our community, getting access to healthy food is a lot harder. Now, we got too much of the golden brown stuff, right? That'll grow your belly, but not enough of the green stuff that'll grow your mind. So how do we make sure that we're solving that problem by being able to intervene? So that's like one way of thinking about it.
But the master plan, that's what I'm asking.
Building it out.
Building it
Building
out.
out.
Thank
Yep.
you. That's what.
Thank you. When do you plan to roll out this?
So what's going to happen is hopefully we bring in these funds, right? We start to make investments in personnel who can start to plan. In fact, we've hired out for the first time in a long time, we have a director of community engagement helping to think through some of these questions. We'll be hiring a team of community health workers. That team will put together a set of interventions that'll fall under the hub. We're working with local communities around questions like housing. So hopefully over the next year, we'll have a much more robust plan. The other piece of this, right, and as we think about the department overall, the other piece of this has been some of the programs that we've brought to this table. In fact, one that we're going to talk about just now, right? A series of programs that help to build out, right, a set of interventions against this. So it's all part of the same set of goals. And in fact, Commission has been engaged in approving as we've been rolling them out.
Okay. You mentioned housing. What are your plans for some housing?
So we don't have a housing department, obviously, right? And that's with the local communities. But when we think about funding on the table through the state, when we think about how we work with, for example, the city of Detroit around their housing decisions, can we start to build a cross community space where we can come together and ask, how do we not just say, all right, when you think about the history of housing, and for sometimes it was building housing, later on it was subsidizing housing, but we've never really done it intentionally for asking, where are the housing interventions going to be the most effective for health? And we think that we can offer perspective on that by working with local communities around those questions. And the way you engage in that front is going to look a little bit different than just housing provision, which is how we've thought about housing in the past.
Well, every fourth Monday, I do a community breakfast. And yesterday, I probably had the largest group that I've had in some time. And that was one of the questions about housing. And they're really concerned. So how will we get engaged with the community to talk to them to see what it is that their needs are?
Well, I'd love to come at some point to one of the breakfasts and listen and secondarily, we're making a real investment in community engagement in a way that we haven't in the past. And so we're finally building the team to be able to do this. And our hope is to be able to have a series of, I don't call them health fairs, but community events where we're offering the set of services, listening to the community, and being able to tailor accordingly. So.
Good. We'll work together on that. Yeah, because I used to do health fairs. So when I was in the legislature. So yeah, I'd like to do that.
We'd love to.
Yes. Thank you so much. Both of any more questions? All right.
I'd like to move this item for approval, Madam Chair.
Is there support? Moved by Commissioner Colleen, supported by Commissioner. Well, he'll give it to McCormick. Okay. All right, all in favor?
Aye.
All right, any opposes? Hearing none, motion carried. Thank you all so much. This is really interesting. Yeah, well, we got to figure all of that out. Yes, okay, thank you. All right, next item.
Item 2, requesting commission approval of an intergovernmental agreement with a 2-year option to renew with Health Choice of Michigan to launch the Wantrepreneurs Program.
Okay,
Abdul Al-Sayed, Director Health Officer, and
Chris Johnson, Division Director for Access to Care and also Executive Director for Health Choice of Michigan.
yes.
so
All right.
this program is in keeping with the goal of thinking about social determinants. We see this as an opportunity. So what the program is an investment of 3 months of free health insurance coverage through our Health Choice program for new small businesses defined as small businesses that opened after January of 2024. And this, of course, is about providing people healthcare, sure. The other part of it, though, is about making sure that we understand the connectivity between healthcare and jobs and job access. We have, because of a weird accident of history in this country, we require, in effect, folks to have a job to get access to private health insurance. And that's the predominant way that people under the age of 65 have their insurance. But for a lot of people, the fear of losing insurance is what keeps them from opening a small business in the first place, right? You can imagine if your kid has asthma and you've got a great idea for that next awesome innovation, but you've got a comfortable job at you name the corporation, you might be less likely to go leave that job to start your new endeavor if you're worried about your kid being able to get their asthma care. And unfortunately, in our community and so many others around the country, we know that there are businesses that go unfounded because of that worry. And so what we're trying to do is, in some small way, de-risk from a healthcare standpoint, the ability to go and start a small business. And if we're serious about the project of building small businesses and building jobs, then we've got to be serious about making sure that people are protected against the healthcare consequences of doing exactly that. And that's what this program is intended to do. Now, it's not, it's a one-time investment, which we, based on our analysis, believe will cover 750 new small businesses across Wayne County with 3 months free health insurance. They're required to stay with Health Choice for the next year. And we feel like this can both demonstrate that interconnectivity between jobs and healthcare, and more importantly, for 750 businesses and the hundreds of employees that they have, that this can be a really important benefit for them.
Okay. All right, Commissioner Marecki.
Thank you, Madam Chair. So you said they're required to stay. What's the consequence if they don't stay?
They would have to pay back the
3 months.
the 3 months.
Okay, all right.
And this is not, if you can imagine a small business opens up, they take advantage of the 3 months and then 6 months in, they can't make it work and they fold. We wouldn't come after them for that.
Okay,
But it would be the situation where they say, okay, cool, we're good. And we're going to go and, engage Blue Cross now. That would be the challenge.
okay. And I just want to thank Felicia and her gang for looking into all the concerns. And I'm wondering, Madam Chair, if I could go through the chair to Felicia, if you have any other thoughts or concerns that you would like to, it looks like many of them were resolved, but
Through the chair, as you indicated, majority of our concerns, well, I would say all of our concerns were actually resolved with regards to the document. They did make a lot of revisions. So other than noting that, it takes mutual agreement to terminate, I think that's the only other thing that is a little different from what we normally do, but not necessarily a concern.
okay.
Okay.
Yep. All right. Thank you.
Thank you. Thank you, Madam Attorney. Commissioner McCormick, please.
I noticed that this was first come, first serve. I guess that's my only concern, is how we roll this out and how we're advertising and, I'm just concerned. I'm always concerned about the fairness of these types of programs. So.
I'll say a couple of things and I'll hand it over to Director Johnson. So we hear you, and we, for that reason, part of the budget here is a major investment in marketing Health Choice. And so we want to make sure that we're addressing that by getting out to absolutely everyone we possibly can. The second piece is that if you look at the majority of small businesses that are currently on Health Choice's books, you're not talking about high-income businesses. You're talking about the kinds of mom and pop shops that you would be concerned about in the first place. And Health Choice has existed for some time. It's well known in the chambers of commerce in local communities. And so given the network and the penetration that we've had, we feel like we do a pretty good job getting out into the community for folks who would make Health Choice a part of their business decision. And then the last thing I'll say is we're hoping that commissioners can support us in getting the word out. The part of this that's difficult, though, is it's difficult to imagine what other approach you would take. Because, when you look at new enrollment, we estimate that this program funding, and of course, there's nothing like this has been done before, so you can't know exactly what's going to happen. But we estimate that, the funding is going to last for some time. It's not like all of a sudden 750 businesses are going to show up tomorrow, sign up, and then there goes the funding. We feel like this is going to last probably more than a year. And so given that scenario, we feel like we have ample time to be able to reach out. But your concern is always a valid one. You always want to make sure that the lowest income businesses and the businesses that are most likely to be in communities where folks could benefit, that they know about this. But we've thought through that, and we're doing our best to try and address that problem.
Okay.
Chris, do you want to?
Is it possible we could get a synopsis to put in our newsletters stuff?
Absolutely.
Okay.
And so to the time span that this program, you just alluded to possibly a year. So is it just until the 2 million is expended and then that's it, basically? Okay. And so would it be feasible, and again, I'm going back to the fairness of it all, to limit, I don't know, the number of businesses or maybe per district, the number of businesses that can partake in this? I'm just trying to think of another way rather than first come, first serve, because sometime certain communities are not privy to it, or the information might
Yeah.
be disseminated at a slower pace than other communities. And then so you have a bulk of the folks that had that opportunity in one community and not the other. So could it be that we would say, you know, for the first, you know, $1 million, it's first come, first serve, and then we're going to purposefully work on getting this information out to targeted communities that haven't, or if you see that the majority of businesses in a certain area are taking advantage of the program, cap it at a certain amount so that others have the opportunity. So again, I'm just trying to figure out how to make it more fair, because I've seen in the past where we have programs like this and somehow, some way, the communities that hear about it first take advantage of it, and then those that didn't hear about it for whatever reason, they don't have the opportunity.
Yeah,
So-
I hear you. I think the best approach to addressing that is to make sure that every community hears about it, right? And we're pretty flexible in the way that we can target our marketing. And so maybe what we can do is take a look at like the first set of applications and ask, okay, if we know we're getting a lot of applications from a certain community, how do we make sure that we're really focused marketing in other communities? The worry that I'd have about gating it by specific districts is that you could imagine if you had some of the lowest income districts where all of your applicants came out and you said, okay, that's enough that's as much as we have for you. We're saving them for other applicants in other communities. You could imagine other low income small businesses who could still take advantage of the program in a low income part of the community saying, you know, basically being left out, even if there's money left. Do you see what I mean? And so I would want to make sure that whatever approach we took didn't backfire in terms of achieving the goals that you had. But I do think that if we're able to really target and be smart about where we drive our marketing, right? And we can assess where our applications are coming from and make sure that we're balancing our marketing in other communities, I think we can probably achieve the same end.
And that would be great. I certainly don't want to disenfranchise any opportunities for any small business. If we have a program like this, I would love for it to be rolled out to any and all businesses. I just, again, just looking at the fairness and what I've seen. But thank you. Thank you so much.
If I could just add, one of the, so we sent a marketing plan with the questions when we answered the questions, so you may have access to that. One of the things we're doing in the marketing plan is reaching out to every chamber of commerce in the county. Currently, Health Choice works with a few of the chambers because there's so many of them. But with this marketing plan for this program, it's reaching out to every single chamber of commerce to try to reach out.
And just to that point, I appreciate you, getting the information out to the chambers. However, a lot of the small businesses I know in my community don't belong to the chamber. So they wouldn't necessarily hear about it. And again, that's why I'm concerned because, so thank you. Mhm.
Okay,
Madam
but,
Chair.
yes, Commissioner Killeen.
Thank you, Madam Chair. Little background here. Health Choice has been around since what year?
It's been 31 years.
31 years. And it was originally created really as an economic development tool to help small businesses in providing healthcare. We do have, and I'm on the board,
Okay.
and we had robust discussion when this came up at the board, a lot of questions, including mine. So we do offer an ACA, Affordable Care Act compliant health plan. It's on the federal, people looking for healthcare that get on the federal website and we are there. So it is kind of an economic development tool. And as we discuss this, this is not perfect. However, we as a board want to take the opportunity here to see if this will work, right? We'll know more after, a year and a half, How many people signed up? Are people able to stay on it? Is this something we should be expanding? Because access to healthcare, again, back to social determinants for people and for small businesses to have the ability to retain workers, that people will want to work there. So in the end, I think this is a good opportunity for us to try something and to see the outreach. Now, we know when people apply for license to open a small business, we know who all of those folks are, right? Because that's public knowledge.
It's, Laura keeps that data.
Yeah,
And-
but we can get it from Laura.
Okay.
And so we can reach out to people that are trying to start a small business, you know, and have gotten that far to file paperwork. I think it's very worthy. The more healthcare we can get out there to people. And then, you know, the Health Choice Board will evaluate as we go if this is actually accomplishing the kind of goals that are being talked about here. So I think it's worthy, more health insurance for people rather than less.
Exactly.
Thank you, Madam Chair.
Thank you, Commissioner Moran.
Thank you for recognizing me again.
Mhm.
Commissioner Kleen brings up a point. Is there any vetting of these small businesses, like to see if they're even viable to last over 3 months? I mean, I get it. It's probably very difficult to do. When we were giving out the business monies from the first pot of government, whatever that was called, with COVID, the EDC really vetted companies to see if they were even sustainable. And I understand that would be a very time consuming, but is there anything in place to even see if they've been in business for 6 months, if they, whatever?
You know, this is for the new businesses start.
It's,
you know,
it's automatically new business, okay?
Yes.
okay.
1/1. So.
So it's not businesses that are even up for 6 months, okay?
Correct.
So it's brand new, all right.
Because there's a lot of overhead costs starting a new business. and so
Sure.
We're trying to take this one cost away from them. for
Sure.
a few months.
Now, I'm sure you have a list of, like a map of where all the businesses that have this insurance.
Correct.
Is there any, one area that it's more concentrated in, or is it kind of scattered all over Wayne County
More
or?
concentrated in Dearborn area.
Oh, in Dearborn, okay,
Yes. Yes.
okay. Pretty significant, it sounds like, if you said it right off the top of your head.
Mhm.
Okay, so this is brand new business, period.
Correct, for
Okay.
this program, yes.
And, you know, we also thought a bit
Okay.
about,
For this program,
Okay.
but for Health Choice as a whole.
Yes.
The majority of our businesses, I can
Yes.
say, come from the Dearborn area.
Yes, I thought you were gonna tell us about another program.
no,
that's
no.
coming, okay.
we also thought quite a bit about, we didn't want somebody to say, okay, well, you know, let's say I organized as a Red Roof Grocer. And I see this opportunity, so I shut down Red Roof Grocer and I open up Blue Roof Grocer, right? With all
Right.
the same people. So we limited it to people, you know, the only beneficiaries are people who cannot have been on the program in the past. Right?
Oh,
So
okay.
that way you can't just say, I'm pulling you from here and then getting 3 months free, right? And I'm not really a new business.
Okay, well,
right?
that's a vetting process, so that's
So
good.
we've thought a bit about that vetting question. The other side of it is this. At the end of the day, we're not making like a venture investment in anybody, right? What we're doing is giving employees healthcare. So, you know, if somebody really wants to like figure out a way past our vetting, right? If we've given, you know, a couple extra people some free healthcare, like not the worst thing in the world, right? So you don't want them to do it. And we've thought about the traps, like we made sure that like we really thought that through. But at some point, like the sunk cost here is a couple people who didn't have healthcare got healthcare.
And to Commissioner Baker McCormick's point too, about some businesses not joining the chamber because it is quite at least the chambers I mean, they're pretty hefty, especially for elected officials, but that the chambers might be able to work out something that they're looking for new business. You know, I mean, that might spur them to do something creative about new businesses entering their area, putting the word out about something like this, and then maybe they'll join the chamber since they gave me that info. All right, thank you.
That's why I think it's important for us to get it in our newsletters and get some extra news copies that we can
Mm-hmm.
float out in the community.
And we'll make sure to get you that copy and some information about the program. And please, like, we need you to be ambassadors for it. You know, my ideal, right, is that this program is so well picked up and so well appreciated that, you know, there's an opportunity potentially to say, okay, maybe let's think a little bit about what we can do to extend. So let's get the word out.
When would you open up the application process for this?
So it's going to take a couple of weeks after commission approves to just make sure that we've run all the traps. Our application's open and ready, but we've been preparing in anticipation of your support.
So would you say August, possibly?
What I'm looking at is if it
August.
goes through, the commission gets approved, that the next commission would be August 1st.
Okay, thank you.
Okay, when we say new business, what's the time frame for them to start to be a part of the new business?
So it would be from a new business opening up 1/1 of 24 or later.
So in theory, if you all approved it, they could be up to 7 months old.
Okay. Commissioner Khalil?
Yeah, thank you,
Mhm.
Madam Chair. And when you send the little thing for us to use, please send it in a format that's social media friendly.
Okay.
PDF?
For those. that
PDFs,
can't-
No, we can.
PDFs don't. But Madam Chair, I would like to move this item for approval.
Is there support?
Support.
Been moved by Commissioner Khalil, supported by Commissioner Maraki. All in favor?
Aye.
Any opposes? Hearing none. Roll call attached.
Thank you.
Thank you so much, both of you, please. Next item, please.
F, such other matters as may be properly submitted before the committee.
I don't know of any. Next item.
G, public comments.
Do we have anyone on?
No one on Zoom and no emails were received.
Okay, thank you. Anyone in the audience wishes to make a statement? Anyone in the audience wishes to make a statement to this committee? Thank you. Next item, please.
Adjournment.
So move, Madam Chair.
Moved by Commissioner Khalil and supported by Commissioner Anderson. All in favor? Yes.